All right, so here we're going to do is we're going to tape the thumb for hyperextension. And so here's the mechanism that we're trying to avoid, is the thumb getting pulled back. So you can think about like a ball hitting it, or getting hit with a stick. A lot of skiers, downhill skiers, have their poles in their hands and they fall, and the pole pulls their thumb back like that. So it really causes a lot of damage to what's called the ulnar collateral ligament of the thumb down here. So what we're trying to do is we're trying to keep the thumb down and preventing it from going back into hyperextension. Okay. So we're going to do our pre-wrap, very similar to what we would have done for the wrist. We're going to provide an anchor down at the wrist. And this anchor is a little bit different in the fact that you're going to start with half strips. You're actually attaching that to the very first anchor that you put down. So you're going to come right down here, the web space of the thumb, and you're going to attach it anchor to anchor. So it's going from that side down to this side. Okay. And what I'm going to do is I'm going to do 2 of those, again overlapping by half, and putting those down. Now what I'm going to do is I'm going to put a strip. Some people call it a teardrop, but probably the easiest way to remember is the breast cancer awareness strip, or prostate cancer awareness strip, or support our troop awareness strip. So it kind of has that shape going. So what we're going to do is we're going to place it here. We're going to wrap this around to the anchor on the bottom side, and then we're going to bring this piece around. And then here's the secret to this taping, is we're going to take the thumb and we're going to hold it down a little bit, and then we're going to pull and attach this not down here but straight down to that anchor. So now when that, and I'm going to do more of these, but when I hold that down, she's going to try to go into extension. It's going to hold it down. Now some people like to pull these strips and pull it down that way, but that actually is just pulling the thumb into hyperextension, which is exactly what you don't want to do. And some people put these on too tight, and then the thumb turns purple and they can't actually move it. So you got to bring this piece around, attach it nice and loosely, bring this piece around, attach it down, and pull down. And as we go each time, I'm going up a little bit higher, up onto the wrist, and up to the anchor. And you can see that kind of overlaps. Okay, I want to get to right around the DIP joint. Now you'll see I've used half strips from one edge of the tape. Now what I'm going to do is I'm going to use the other half. I'm going to place pieces from anchor to anchor, covering the entire thumb, overlapping by half, going all the way up to here. I'm going to take another half strip, go right over the anchor, cover those pieces, one more, and if I've done it right, I should end up right where the other half strips started. So that gives me the exact perfect place to take these and now do one anchor right around the wrist. What that's going to do now is it's going to prevent her thumb from, going back into hyperextension.